EGFR TKI, and several studies reports the use of plasma genotyping as the first line testing to detect the T790M. However, the role of simultaneous tissue and liquid next generation sequencing after first line EGFR TKI resistance is still unclear. So the methodology was the patient with the resistance with first line EGFR TKI, they were prospectively enrolled, and paired tissue rebiopsy, NGS as well as cell-free DNA on blood NGS was performed simultaneously. So the results, the 86 patients were enrolled, but 26 of them did not have adequate tissue for NGS. However, among these 26 patients, the NGS on the cell-free DNA revealed T790M in 5 patients, but pairing of the sample was not possible in these 26 patients. So in totality, 60 patients had the pairs of tissue and cell-free DNA NGS available for comparison for which the further analysis was done. So on the right side, if you see the patient baseline EGFR mutation in these 60 patients, so as expected, regarding the actionable mutations, the DEL19 and AL858 are together, they comprise of 92%, while the other uncommon mutations that made up a very small fraction. And if you see the concordance rate between the tissue and the cell-free DNA NGS in 60 patients, the concordance rate for the exon 19 deletion was 87%, for L858R it was 78%, for T790M it was 68%. The left side of the figure is showing the number of patients, that's 60 patients who received the first line EGFR TKIs, and of which the 25% received gefitinib, 45% received erlotinib, and 27% received afatinib. 2 patients received osimertinib, that comprises of 3%, and these were omitted. So the number of patients with the first or second generation EGFR TKI resistance were 58. And in these 58 patients, the mutation landscape of first or second generation EGFR TKI resistance patients, the tissue NGS was performed in these 58 patients. And again, in this set of the patients, the mutation landscape of first and second generation EGFR TKI resistance for the patients on the cell-free DNA was also performed. And we can see that a significant proportion of the patients did not have there was no variant detected in the cell-free DNA. So the mutational landscape highlighted the first line, first or second generation EGFR TKI resistant mechanism in 58 patients, and we can see very clearly that as expected that the 50% they were attributed, the resistance was attributed to the T790M, while ERB2 copy number gain, MET copy number gain, and EGFR copy number gain, they were responsible for 7% each, while other mechanism comprise of 27%. So 24 of the 29 patients with the T790M received second line osimertinib, and there was a good prognostic separation of the curves in two set of patients in which when there was no variant detected in the cell-free DNA, which is highlighted in the blue graph, while when the variant was detected in the cell-free DNA. So the progression-free survival was better when there was no variant detected in the cell-free DNA. Similarly, for the overall survival, again, the overall survival was better for the patients in which no variant was detected in the cell-free DNA as compared to the patients with the variant detected in the cell-free DNA. So to conclude, the simultaneous tissue rebiopsy, NGS and liquid NGS at first line EGFR TKI progression detect more T790M mutation than tissue NGS or liquid NGS only. And at the, sorry, I just forgot just one point in this slide. So in the right side of the figure, if we see, so the tissue was able to identify, the tissue NGS was able to identify the T790M in 24 patients, while liquid biopsy was able to identify T790M in 15 patients. However, in 14 patients, exclusively the T790M was detected in tissue, while exclusively in liquid biopsy, the T790M was detected in 5 patients. So the 5 out of 58, that makes around 9% of the patients, the T790M was detected exclusively in the liquid biopsy, which would have been missed in the tissue biopsy. So in conclusion, that at the first line EGFR TKI progression, the patient with no variant detected in the cell-free DNA NGS may have a longer second line osimertinib progression-free survival and longer overall survival after cell-free DNA checkup. EGFR, HER2 and MET amplification might contribute to the vast majority of resistance in the T790M negative patients. And NGS at EGFR TKI progression provides more information for the sequential anti-cancer therapy. Thank you.